I wanted a six pack when I was going to get married, and I wanted like abs, a flat stomach. And I think that is one, I think you're chasing something that you can't get if you don't have a functional core. So I think that it's a little bit out of reach for me. And so I think that I really regret doing like a leg lift, for example. Like I couldn't keep my lower back totally on the ground. Well, that was a sign that my deep core really wasn't strong, or was at least wasn't engaging and activated. And I was plenty strong, and I think that's the difference. Is dysfunctional doesn't mean you're weak, but functional means that you are a system that can handle anything. And that means like injury prevention. It means a pregnancy, you know.
Hello, and welcome to another episode of Find Your Fuel. I'm your host, Erin Martin. And if, like so many women, you've struggled with your pelvic floor, wondered how to approach fitness before or after pregnancy, or like me, didn't do anything to heal your core after kids, then today's conversation is for you. Our guest today is Erica Wald. She's a specialist in pelvic floor health, functional core, and prenatal and postpartum training. She's also the founder of Commit Fitness and the creator of a digital fitness platform, Her. She's a wealth of information on all things women's fitness and functional core as your fuel for today.
When I got my degree in biochemistry in college from the University of Kansas, and I don't know, it was one of those things where I worked in a lab for a year after college and quickly realized like I was working hard to be okay at it. And I danced my whole life, certainly like understood my body very well. I wouldn't say I was like a personal trainer at that stage at all, but my girlfriend and I moved to Denver sort of on a whim. We're like, let's just see what we can do. I thought fitness was intriguing, and I thought I was just going to be better at it. And I do enjoy learning the body, especially like even on a cellular level. Obviously, I did get my degree in biochemistry, so I am still interested. I was always still interested in that. I think I just, didn't feel like it was a good fit. So when I moved here, I quickly started working with brides. That was my first. I was more marketing than anything else, but it became like really a passion too. I mean, working with brides is so fun. It's very different. There's a lot of motivation, and obviously it's a great age for change for anybody. And it was like it was just me. I rented space. So it was just me for a very long time. I think I did that for maybe 6 or 7 years before we got our first studio. Met my husband, had this kind of like out there dream that maybe we'd open a gym one day. I always knew I wanted a family. So when you're a personal trainer, you think like, how do I do that? Right? Like, okay, right now I wake up and I get to the gym at 6 a.m. and then I have to be there in the evenings. Like it just doesn't feel conducive. So in my head, I always thought like I'd have to have a gym. Like that was my mentality. And there's other ways to do it. But for me, that like made the most sense. And it also was a way to help more people. I had a full calendar, and since I started training it was something I was good at. Like in comparison to science, it was something that was so natural to me. I enjoyed it. I love teaching and like problem solving. I'm certainly that Enneagram where I problem solve, and I like to I like to find the answers, and I'm okay not having them because that's almost like a challenge for me. So that's sort of how it started. Obviously my clients who got married had babies and got pregnant, and I was kind of on a similar trajectory. My husband and I got married in 2018, and we got pregnant in 2020, so not too far off. And so I think I got by with like research for my clients in the beginning, but then once I became pregnant, everything really changed. I quickly realized like I had been in this industry for 7 years, and I knew so little about my body at the time. Like it was changing. There were things that like I thought I was great, and I probably was in some way still a great trainer in a different realm, but in that space, I was like a little baby. I had no idea what to do. I was honestly through pregnancy. I want to do it again so bad because I like regret everything I did. I was like, wow, I learned so much by doing things wrong. And I won't couldn't ruin anything necessarily. I could have done things so much better and had a much simpler recovery. But I really didn't start learning until my certification was finished, which wasn't really until like I basically had my son. At that same time, we were opening our first studio in Wash Park, Denver. So I was about 3 months pregnant, I think, when we signed our lease, middle of COVID. It was an insane time. I don't know why we did that, but it turned out okay. Um, we at that time, I was like, "Okay, this is what like, we need to focus on this. Like, I need to learn more about it, and we all need to start teaching people this," because I was almost, like, upset that I had spent years coaching women to the best of my ability, but still wrong when it comes to
Mhm.
pregnancy and postpartum. I think everyone, though, is doing that. Everyone who's not certified and who's not trained is doing what I did, and in my head, I'm like, "That was a disservice," and I've learned, and I mean, I still have most of those clients today, so I feel grateful that they've grown with me, but at the same time, I think that it's, like, just this realm that no one understands till they're there, and, of course, if everyone would just, like, do it before they got pregnant, everyone's body would be better whether you were gonna never have a kid or have, like, 5, but ultimately, until it becomes relevant for you, it's not really a priority, and obviously, I'm sure you can speak to that, and obviously, that was my own story too. So I think for me, it became like, okay, this can't just be me. I'm only one person. I already have a full schedule. I'm about to go into labor, and I have my own recovery. So I really used myself as a guinea pig on the postpartum side of things. My pelvic floor, my birth was so long and hard. It was 36 hours, and it was 5 hours of pushing. I got an epidural so early, too early. I wish I wouldn't have um, done it that early. And my pelvic floor was just trashed afterwards. It was like I didn't do any mobility, I didn't do anything, so my son just did not wanna come out, and so I think just with that, I've learned so much, and that became, like, a huge passion of, like, okay, how do we make that not happen for other women? Like, how I know there's ways. Like I said, I'm a problem solver, so I really dove deep into it, and surface level, obviously, I got certified, and I think the certifications are sort of more of a check on the list, in my opinion. I think they're fine, and I think they're necessary, but hands-on experience is irreplaceable. It's irreplaceable. I've worked with now
Specific
hundreds
pelvic floor certification?
like a pre and postnatal certification. So they have
Yeah.
like general ones where it kind of walks you through that. And the principles are important. Like is it surface level breathing? It does talk about, yeah, it talks about the pelvic floor and deep core and posture and movement patterns, that kind of stuff. Um, but how many kids do you have?
I have 2.
So you have 2 kids and 2 pregnancies. And now times that by, another 100 women, everyone's story, all of them are so different and everyone's pregnancies are slightly different, and it's just like insane because the book just teaches it kind of like a general way, and when you work with people in person you have to see it on like a spectrum. Everything is has to have gray areas, it has to have give and takes, and it has to have like more what's the word? Like progress. I think when a coach looks at it as like, you just can't do this, or this is what a book says, I think it can really like halt or stall progress for women. Because sometimes you can do so much more than you think you can in one area, but maybe in another you can't. Maybe it's posture that's your real limiting factor. But that doesn't mean that you can't go on and, progress in other ways and work and push yourself in other ways. So that's where I became really passionate, and that's where I wanted to be different, and I wanted to really change the way pre and postnatal fitness was taught. Like I wanted women to have a more open mind, and be really more like malleable and flexible with her body because it is like it's such a beautiful thing. Like pregnancy, it's like supernatural to me. I'm like, that's not real. It's so crazy. But I mean, the fact that we can do that, like we can do way more than I think people think. So I became super passionate, and now we have like 9 certified instructors who work at both of our studios. They're all incredible. Our certification is very intensive. It goes really deep into a lot of scenarios, and it requires a ton of hours of shadowing and hands-on experience. And so, obviously, like teaching other people has really helped me too. But I still see things that are shocking to me, and I've been doing this for a long time. And I hope I continue to learn because it is so rewarding helping women.
Yeah, and what are some of those initial things that you wish you would have done prior to pregnancy? And then we'll get into today, like post-pregnancy, like me, for example. I'm so excited for
Hmm.
this conversation because I didn't do anything, like a
Yeah,
lot of women
yeah.
after pregnancy, and just the thought that it's not too late is also very inspiring, so I'm so excited to pick your brain on that too. But first, curious what you wish you would have done. Is it just a stronger core? Is it fitness in general going into delivery? Like, what are those things that you wish you would have done?
Yeah, I mean, I certainly think learning the core on more of a functional level versus just abs. I wanted a six pack when I was, gonna get married, and I wanted, like, abs, is the best way I can describe it. I just wanted
Yeah.
a flat stomach, and I think that is what one, I think you're chasing something that you can't get if you don't have a functional core. So I think that it's a little bit out of reach, and for me, and so I think that I really regret. I doing like a leg lift, for example, like I couldn't keep my lower back totally on the ground. Well, that was a sign that my deep core really wasn't strong or was at least wasn't engaging and activated. Um,
Right.
and I was plenty strong, and I think that's like the difference is like functional doesn't or dysfunctional doesn't mean you're weak, but functional means that you are like a system that can handle anything. And that means like injury prevention. It means a pregnancy, And so I think building that, and you can build it when, like I said, most people don't really have the motivation to do it until they're pregnant or even postpartum. But you can start working on that during pregnancy, and pregnancy is really it's awesome if you do because pregnancy is a great opportunity to learn different ways to work your core that are not abs because it isn't super intelligent to lie on your back and do a leg lift past like 20 weeks pregnant. I don't
Mhm.
really love like saying you can't do things. I don't love that. But I do coach on an online platform and I coach thousands of women, so I do have to have some standards of like, for the most part, this is gonna be really challenging to do it without coning or doming or. So that's kind of how I look at my online platform if I'm not in person with a woman. And a leg lift is a great example. Like there's just better exercises, in that stage in your life, in that stage in pregnancy. Like working overhead more, I wish I would have done, and thinking about the spine as like our stabilizer and then like where our strength comes from. Mobility, I think so many women are told not to twist during pregnancy, and then they come out of pregnancy with like really dysfunctional spines and like thoracic areas, so that middle part of our body. And so really learning that I could twist, but in the right way. So I think that would be something. And then mobility. I talk a ton about mobility, but I 100% feel like there's a couple reasons, but that's one of the bigger reasons that my son was stuck in my pelvis for so long and why I pushed for so long. I was a dancer, so I have like a natural turnout, and that's fine. That's what gets the baby down there, right? That's like the kind of opening your hips up. If you think of your pelvis, like, the external rotation is like what we all think of for like stretching. That's fine. But that's a good way to get stuck. And so, really needing to teach your pelvis to also rotate internally to actually push your baby out is something
Yeah.
I didn't even know about. Honestly, I didn't even know about it 2 years after postpartum. And then I injured my back. And that's when I really started understanding like spine, hip, pelvis mobility on like a greater scale and like how important that is for things like aesthetics too. Like, I don't know, people like you think you want to look a certain way, and I've been there, so I understand that, but um, like that sometimes is a limiting factor. So anyway, I think mobility, certainly like unique and better ways to work the core in a more functional everyday life type of way versus just wanting to look a certain way. I think those are like the two things that I wish I would have put more energy in too.
Yeah, and I have heard that your core is like the steering wheel of your body. Like, it's really the
Hmm.
foundation and everything of how yeah, like your stance, your back pain. I mean, we often think when I think pelvic floor, the first thing I think of is Kegels, jumping on a trampoline and peeing yourself, all of those classic things as women,
Yeah.
but there's other things too that
Yeah.
having a strong functional core can contribute to that's beyond just, the peeing yourself factor.
Yeah, and I mean, these days, like, especially in Denver, people are so fit and active that a tight pelvic floor is so common. It's actually I see more of a tight pelvic floor these days than I do a weak pelvic floor, and, like, think about just like a runner. 100% of the time, they have a tight pelvic floor. that is going to create a ton of back pain, spine issues, and then also leakage, pain with sex, like pelvic. That to me is not any worse or better than a weak pelvic floor. They're both dysfunctional. I always think of it as like if you were doing just like a half squat and you're kind of stuck in that like halfway squatted position, you're only working one tiny part of your leg. That's like this middle part of your quad. If you go all the way down in your squat and then you come all the way up, now you're working your entire lower half, which is what a squat should do. Like working your pelvic floor is exactly the same way. If you're always engaged and flexed in that like tight position, you're just only exercising that one piece of your pelvic floor and you're never totally getting a full contraction, which means that there's a lot of dysfunction in there.
Yeah.
And that's fixable. Like, I don't say that with like be afraid or be worried. It is not even that hard. It just takes intention, if that makes sense. Like, I think it feels like such a big task to a woman. And it's
Yes.
not. It's tiny little things that you could add into your day or your workout. It doesn't have to be this huge thing. It's just like small little habits that help so much. And I think I understand how it can feel so overwhelming and like kind of like I'm just screwed, you know?
Yeah. Or people just think, again, I need to do Kegels. And then, you're
Yeah.
driving and you'll attempt some Kegels and you're like, well, that didn't work. And then it's like,
Yeah.
okay, well, what do I do? So I think the fact that we've moved to having more options, that there's, people like you out there who's educating and available as a resource. I mean,
Mhm.
when we got punted out of the hospital, I remember getting a call from a nurse being like, how are you doing? And it
Yeah.
was like, that was it. Like, there's no like, questions
Mhm.
about the pelvic floor or like specific questions about mental health. So there's all these things that we're learning and we want to do better for the next generation.
Yeah.
And I'm curious for you too, what are some of those cues or like little things that we can do to incorporate on a daily basis? And for me, I even personally, selfishly just think about my own hot yoga class. It's like I so often they have the little 10-minute section of core. And just, before kids, it was like, I can do anything that the chick next to me can do. Like,
Yeah.
I'll just plow through it and do it, even if it's bad form, even if it's not what is truly working a good core. And now I'm rethinking everything that the instructor is telling me to do from a core
Mhm.
perspective, trying to remember some cues of like, okay, how do I engage? How do I modify or do something that's very different and built for me and working
Mhm.
or the way I should, not just, what every single lady is trying to do out here that might be bad
Yeah.
form. So,
Yeah. I mean, biggest thing is do not sleep on 360 breathing. It is really hard to
right.
move past any type of it's hard to recover. I haven't seen much recovery be successful without truly putting emphasis into the 360 breathing. And that's because I don't know if you watch your child breathe, but when I started learning this, I started watching Asher, my son, breathe, and he was like 2 at the time. And he's breathing the way you should be breathing. When you inhale, air fills you up. When you exhale, your tummy draws in, right? So he's 2, he's naturally breathing the way we're supposed to. We all grew up in the skinny culture. So more times than not, I see people breathing in reverse. So when they inhale, they suck their tummy in, and when they exhale, their stomach expands out. That is in reverse. So, and that's just like a sign of dysfunction. But because we grew up in that culture and because we grew up in trying to always look skinny, think about how you've sucked in, or I don't know if you have, but like that's a really common thing. I know I did when I was 13. But with that, we need to reteach our body. So this needs to be like a habit that we reteach. So I start right when someone's pregnant, if I'm working with them already, and I introduce it. Having it down by 16, 20 weeks is when it becomes super important. And if you've never done it and you're postpartum, it's not too late. But, in an ideal world, you've really learned it because that is how you should walk and talk, pick up your kids, pick up your groceries. It is how you should breathe all the time. Every time you do a 360 breath properly, that's basically just managing the pressure in your body. So, pressure, like if you avoid jumping on a trampoline, I get it. But at the same time, like everyday pressure is still there. So, avoiding impact isn't the answer. It's also not the answer to go jump on a trampoline 6 weeks postpartum, for the record. But it's
Yeah.
the but introducing impact is something that's really scary, and I understand that. However, it's something that is so important and key in this. So when we breathe, we inhale through our belly, our back, and our pelvic floor. Air fills us up, and when air goes places, that's when an area should relax. Okay, so we fill up sort of if you were to have an inner tube around your waist. You want to inhale short or long and slow and fill air everywhere around your body. Okay, so tummy breathing, people are really used to saying. Tummy breathing is not an appropriate saying for what I'm talking about. We want to get air even into our back, which is like into our rib cage. Um, and so as we inhale, we expand and relax. As we exhale, we draw up, starting with our pelvic floor, and we engage kind of like you're zipping up your pants. From the bottom up, we want to bring our hip bones up to our rib bones versus bearing down. Because as you bear down, that is pressure going out. So that's when you might feel leakage. That's when you might, like mostly leakage, I guess queefing even is like a thing that you might feel. That's, not a healthy thing. So breathing is something that you need to learn and you need to not get lazy with it. And if it gets shorter and you get bored with it, so did I. I get it. I feel like I always say there's like a relapse around 9 months when you start like seeing and feeling change and you stop doing that. You a lot of times have like a pelvic floor relapse. It's okay. Just get back into it. But with that, I would say breathing is the most important thing. And then lightly adding in impact. Doctors, I don't know why there's like, don't do anything for 6 weeks and then there's do everything after that. It like is a very big miss, in my opinion, for women. I do think working on the breath work right away, lay in bed with your newborn, perfect. It's not impactful. It's great for you. My program, it's called Reconnecting. So the weeks 1 to 6 program I have in my app is reconnecting with your body. We're reconnecting with our core, with our pelvic floor, with our back, and with our glutes, everything that's in the center of our body. And we're trying to get it to talk as a unit. So that is, I would say, like the most number one tip.
This breathing thing is blowing my mind right now because I for sure am the one who's been doing it wrong my whole life. Like I
Yeah,
literally as you're walking through, I was trying to like practice doing the inhale, relax, inner
yeah,
tube, and then the
yeah.
exhale zip. And that is I can't do it. Like I'm gonna have to practice.
Yes, and you should. It is hard, and that's why like reps. I tell every woman like I always say the first 10 reps are throwaways. You're gonna do it wrong. Even if you don't do reverse breathing, you still probably won't do it right. You might breathe with your chest or your neck or, something like that. Um, but throw them away. It takes a lot of reps. It takes like 5-10 minutes a day. That's why early postpartum is such a great time because you're just, you're in newborn stage and you're tired. So it's such a great time to practice it. But it's a habit. I mean, I don't know how long they say habits take to form, but it's not fast. So Kegels are something I've never told anyone to do, for the record. So this is like the new age Kegel, if that makes sense. Coaches who
Mhm.
are coaches who are on the progressive side of pre and postnatal fitness, they're going to be telling you this. They're not going to be saying go do a Kegel. Now, other things that if you have a tight pelvic floor, pelvic drops, which is basically a method to relax your pelvic floor. I recommend those at nighttime or after workouts. Yeah, and then I think other than that, it's understanding the cue or understanding the like I always say, a symptom is more like a notification on your cell phone. It should be answered. It's not necessarily a bad thing.
Mm, I
So
like
like
that.
say you're in your yoga class and you feel pressure or you feel coning maybe in like a high plank. Okay, well that's a notification. Okay, I need to respond to that. Maybe bring your knees down, do a big 360 breath, engage again the way we just talked about. Bring your knees off the ground. See if we can hold that position without that. If so, then you're good to go. We don't need to just immediately modify. We need to step back and be like, maybe I can try to do it right and then see what happens. And if you can't and you're just coning and it's a lot of pressure and you're leaking, whatever it is, then you stop and then you modify. There is a time and a place to modify, but it shouldn't be the first thing. I think our mom and dad didn't give up on us when it comes to walking, right? Oh, nope, she fell down. No, thank you. Like, no, they didn't give up on us, right? Like, this is the same thing. Like, we don't give up. We have to just keep working at it and getting better at it. And soon enough, it will become a habit, and you won't even really notice that you're doing it and you're breathing properly. But yeah, that was a
And then
long-winded answer.
describe coning. So what should we look for when coning's happening and then
Yeah,
adjust?
yeah, coning. It kind of look or feels how it looks. So it's So doming, there's two different things. Coning is going to be the most common when you're actually pregnant or postpartum. So we have we have our abdomen, right? And then imagine someone with a six pack. There's sort of a line in the middle, right? And then you have like the hard edges right next to that line. Okay. So what holds those edges together is called linea alba. That holds our abdomen together. When we're pregnant, that stretches out because we need it to. It's essential, which is why DR, diastasis recti, which is what we're talking about here. It's not a huge deal. I'm 5'1". There's nothing I could do fitness wise to make it so I didn't split my core when I was pregnant. I'm very short and I had a normal sized baby. So when that happens, our abdomen splits. But our linea alba can stretch and it can also thin in some situations. If it is thinned or we're not managing the pressure, we're going to cone. Okay. So you imagine kind of round and then it kind of points in the middle, sort of like a dinosaur spine in the middle of your belly. That kind of makes sense. That is going to be called coning. That means that you're not managing that pressure. And so it kind of feels
Oh.
how it looks also. It feels kind of like a little tugging. It doesn't hurt. It just feels how it looks. Doming is more of like a plateau or what's the word I'm looking for? Like a little flat top that's longer than a cone, but then it still pushes and protrudes out. That would be more common for someone who's probably never had a child, who just has a dysfunctional like core, like a weaker internal core. So that is a little bit different. A lot of times you might see more doming like further along too in your recovery. But the linea alba is something that I've seen people with a huge split in their core, like, for whatever reason, but their linea alba, if it's strong and thick, it doesn't matter. You're handling pressure, you're managing it. So that's really not the issue. It is more about managing pressure. With time, your DR might come back together. It might never. I still have a little bit of a split. I don't ever cone. I couldn't barely cone if I wanted to at this stage. So, yeah. Does that make sense?
Yes. Yeah, that's
Yeah.
super helpful.
Yeah.
And I think another thing that I always have in the back of my head too to prevent that coning or have good posture is when you are doing abs, if you're again doing abs,
Hmm.
working on your core
Yeah.
on your back, is to ensure that you can have a blueberry sit in your belly button correctly and not roll out as a tip. I don't know where I heard that from, but is that accurate? Like, how do you want to think about other cues in your body of having good,
Yeah.
structure, posture, approach?
Yeah, I think it would depend how deep your belly button is. My belly button's kinda deep. I think the blueberry would stay. Um, but I hear where that's coming from, and it's not a bad cue. Biggest thing is gonna be that your lower back is, like, flush on the ground.
Mm,
That would be a big thing. Bringing your hip bones to your rib bones, so, like, that upward, which is sort of like a pelvic tilt motion, if that makes sense, sort of like having your hips
mm,
in tilts. But a really good modification and something that's so easy is just putting like a little towel. Say you're in a class, like fold your towel up so it's maybe like, I don't know, a couple inches high, put it right underneath your tailbone. And then that's going to put you in the correct position that you need to be in, right? It's going to kind of give you that little help that you need to get you into the right position. That is way better than doing the exercise wrong, or like arching your back. A Pilates ball, if it's like, you're at home and you have one, that's another way to do it that adds some instability. But it's really just keeping your lower spine flush onto the ground, if that
yeah,
makes
that makes
sense.
sense, and that's what I always just try to remind myself because
Mhm.
it's like the work that I'm doing, like, I need to be feeling and more connected to
Mhm.
my core and pelvic floor to understand where those boundaries are, where I'm applying too much pressure, and it's very much me. I can't be like, "Okay, try to do this,"
Yeah.
20 times in a row because everyone else in class is doing it, and I'm just as strong as them. It's like you gotta completely shut that down and just
Yeah.
really try to be in tune with your body to understand how to tailor everything to your own situation in group classes.
Yeah, I say that a lot in group classes. So when we have women who ask, "Oh, should I do the groups or should I not?" I always tell them, like, especially if they're not interested in our pre and postnatal, which normally they are, but I always say it really depends on how competitive you are. Because if that's your outlook at that stage in postpartum, it's tough, right? Like
Yeah.
that isn't where you are right now. You're in a season, like it's okay. And also, you're gonna probably come out stronger than most of those people because you're gonna be training intentionally and like truly functional, having building a functional core. But I do always say, like, it kinda depends how competitive you are because you don't want to be looking to your left or your right and feel like you need to be doing more than you are. It just needs to be doing, like, the right thing more than you need to be doing the right thing for you. But that is why there's so much power in, like, learning your body and learning really where you can push and where you can pull back because I think it can feel super defeating to feel like you always need to pull back, and that's something that it's a stigma I want to, like, not be there for women because it's not true, you know? Like, there are usually you have 1 or 2 bigger things. You don't usually have everything going on with your body when you're postpartum, you know? There's many women who have a C-section and their pelvic floor is usually okay. So there's a lot of things they can go jump on every trampoline, you know? So it really is dependent on the person, and I think learning about that is so powerful, and it really can be, like, uplifting for women realizing, like, "Oh, I can do XYZ, and maybe I just need to be attentive to this." Yeah.
Yeah, and put in the work. I think that was one thing I didn't really realize, I mean, at all, post-pregnancy was you like, this is PT. Like, this is you need to think about it as straight up, it's not you're in this
Mhm.
craziness of a newborn, you're trying to, like, survive, and I wanted to get outside to just get
Yeah.
some fresh air, like, get back to running because that's what I loved. It was more about activity for me was more about the,
Yeah.
mental health and
Yeah.
also moving my body and some of those things, but I just had no clue about the PT side of it and how critical it would be to heal properly and not go from, "Okay, 2 weeks doing nothing, jumped into a run." Like, I remember the first I did a race
Mhm.
maybe 3 months after I gave birth and, like, felt great, it was so fun, but just halfway through, I was like, "Oh, I'm completely peeing myself. Like, this
Yeah.
is, like, new and horrible." And then I don't even think I did anything about it. Like, I wasn't like, "Oh,
Yeah.
now I'm clued in that I should probably strengthen my core." I think I was just thinking, like, "Maybe that'll resolve." I don't even know what I was thinking, but now here I am today. I'm like,
Yeah.
"Okay, time to get serious." I downloaded your free, 5-minute
Yay!
routine guide to be able to see, like, what can I do now, to be able to
Yeah.
just
I
live
mean, I think
properly.
honestly, like, I can relate so much to just, like, being ready to go postpartum, like and that's a good it's a good thing, and the mental health piece, to be honest, that is better to focus on. If you only have room for one or the other, a a pelvic floor can be fixed, but, like, mental health, being there with your baby and your family, like, I'm not one to say that's not as important because I think it is. I really do.
Yeah,
In my ideal world, I just think you can do both. Like, I
yep,
really do. I think you can run. Maybe not a race at 3 months, but, like, I
yeah.
think you can maybe have a goal for 9 months, like, and easing into it and working up to it. I always say, like, what I teach and what we teach with our women is we are the gap between personal training and PT. That's where we are. We're right in that in
Mm,
between space because we can pick up barbells, we can lift heavy, we can do things controlled and put our body under pressure. But first, we activate our core and pelvic floor. Then we activate our glutes. Then we make sure that, I don't know, our posture and we do upper body posture things. And then we get into the movement, right? So I think that's like the space that people don't realize is available to them because that is something that I was like, I'm not going back and just doing, I think people look at pregnancy fitness or prenatal postpartum fitness and think it's boring. And I think because a lot of it is bland, I'm not gonna lie. I think there's a ton of bland programs out there, and I'm not hating on anyone. I think it takes so much effort and energy to learn and be confident enough to speak about this topic, so there is nothing wrong with anyone who's putting anything out there at all. But as someone who cares about, like, not feeling like I have to do less, this is like a space that I'm super passionate about because it is available to anyone who wants it. And so I think that that's something I want women to really understand is like both is totally doable. You just have to be willing to learn about yourself.
yeah, and all
Yeah.
the I think new tips or tricks or tactics that we just never learned about that are so foundational. I mean,
Yeah.
it's crazy to me that, like, we learned the foundations of nutrition. We there's foundations of other
Yeah.
things that we learn, and as women, this birth is a huge big one. Like, why don't we
Yeah.
learn the foundations of healing our bodies after something like that as
Yeah.
well? So, for someone like me then, is it helpful to know if you have too tight of a pelvic floor or too loose? Or what would be a best next step for me? Does it not even matter to really know because there's some core things to work on that are helpful regardless, like the breathing and then doing some core exercises, right? Like, what's the best approach?
It's definitely valuable to know. I mean, I think symptoms would be like my first question. Like, are you leaking? Do you have like lower back pain or pain with sex? Those would be signs of of a tighter pelvic floor. So, seeing a pelvic floor therapist is the limit of someone like me, right? I don't do internal exams, and no one is going to do an internal exam besides a pelvic floor PT. So, seeing a pelvic floor PT for any of those signs is like absolutely something I would do. You don't have to go a lot, like once, twice, get information. That's the
Yeah,
biggest piece is get
learn
information. It
about your
doesn't
body.
Yeah, it doesn't have to be a thousands and thousands of dollars like over the course of months, even if they're asking you to do that. As long as you're willing to put in the work outside of there, you don't have to. You just need the information. You need them to tell you what it is. Because here's the deal. I went and saw a pelvic floor therapist around the time when I was having like low back pain post. I had that like a year and a half after my son for reference. And I lost the weight fast. I went hard. I did all the things too, right? But I wasn't totally healed. And so that's where the pain comes in, and that's where like injury can sometimes creep up on us. And so I went and saw a pelvic floor therapist. My mind was blown. I mean, I geek out on this kind of stuff, but there are like, I'm going to butcher this, but there are like so many more muscles in the pelvic floor than you would imagine. We should like find a picture and put it up here for this because when she told me, she was like, "Yeah, this one," because I was having some like weird hip something, and she saw one tight area in my pelvic floor, pushed on it, and it referred to my hip pain. So like it is so minuscule on what could be affecting it, and they can dry needle, which I know sounds scary, but it's really good if you're open to it. Like they can dry needle, even just like massage or like the feeling, if your breath work is correct, is really helpful too. Like they can physically be like yes or no. That tactical feedback can be really useful for you. So I think that like seeing a pelvic floor therapist is invaluable. I think it's absolutely something you should do, and certainly anyone should do if it's in their budget. But like I said, I don't think you have to go a million times. You just need information. Then I think beyond that, i- if you have never healed or put effort into healing, then you're still postpartum, you know, and that's okay. Like, that's totally fine. I remember I worked with a woman who had 3 children. She had, like, 1, C-section, then she had a VBAC, and then she had something else crazy. There's maybe a lot I don't remember, maybe another C-section, but all kind of, like, up and down. She was, like, 15% body fat, so very lean. She was a runner. Her core, her stomach looked like she was 30% body fat. It was crazy, and it was the
Mm,
skin. It's skin, right? It's not fat. It just looked like that, and it is the activation. So, like the muscles go dormant, and if you never wake them up, they don't come back online, if that makes sense. So,
yeah.
like, that's where the breathing comes in. It basically is like an accordion in and out, like, just kinda, like, pulsing and, like, helping those muscles get some life and some blood worked into them. So, if you've never done that, it doesn't really matter how old your kid is. Like, my mom, before I knew all this, she went and did that surgery, so she stopped peeing herself, and I was like, I wish like, even then with I was probably 25 at the time, like, I would've even then been like, "You still could work on that." She probably wouldn't have though, but yeah, ultimately, it's about, like, treating it just like that. So, I mean, you obviously aren't gonna like probably pee yourself quite as much as you would if you were brand new postpartum. But yeah, treat it like that. Learn the breath work, apply it to every single movement. Inhale on the easy parts, exhale on the hard parts. Keep it simple and work into different positions. I think looking at posture can be really valuable. I have an online postpartum assessment that is a self assessment that I walk you through on my app. We also do it in Denver in person because there's just so many things that like I said, you might be fine in a lot of areas, and there might be something that is really important for you. So I wish I had like a very clear cut answer for everyone who's just like listening and looking for that. But ultimately, just like you heard the first time you were pregnant, like everyone's body is different. That
Yep.
applies, and it's so true. So I think yeah, I think that if there's a professional available or like doing like a postpartum assessment, which I created that, so I probably just have to do it from me, or if anyone you can meet in person, I would say that's like the most valuable thing you can do is information.
Yeah, and I'm curious with the posture piece too. It's also like after birth, we're holding toddlers on a hip, and like, of course,
Mhm.
I only did one hip. I don't know why. I wanted my right hand free,
Yep.
so it was always my left. So what's going on with the posture piece of it? Is it that we're not strong enough to hold correctly, or is it that we're just like standing wrong that's impacting things? Like, what's happening there?
So posture is just another piece of your core. So, and it's your spine. Posture is all obviously is about your spine. So our spine is in our trunk, which is in our core. So if you, I mean, posture is it's frustrating because you get pregnant, your boobs get bigger, your belly gets bigger, so you get into that anterior pelvic tilt. That's kind of like when you stick your butt out, if you know what I'm talking about. That
Yep.
works against you. Then you have your child, you breastfeed or you hold your baby, that works against you. Posture is something that is tough. There's not like a great way to sugarcoat it, but being aware of what your posture is, which that's not hard to deduce. Take a picture sideways in a mirror, standing. Don't try to stand perfect, right? Stand how you would normally stand. If your butt sticks out and you have like an arched lower back, there's a dip in it, that would be an anterior pelvic tilt. If your butt sticks in almost like looks like you have like a pancake butt, you don't have one, and your shoulders are rounding, that's a posterior pelvic tilt. They both have their challenges. Some people pregnant or some people postpartum have both because of pregnancy and then holding your baby. It's tough. But what you can do to work against it is, let's say that you've got rounded shoulders. That's a really common one. You need to strengthen the muscles that are on the other side of it. So all of our like our posterior upper body, like a rear delt. So the back of your shoulders, your lats, your lower traps, those muscles. Because if you think about it, if they get stronger and flex, they're gonna pull you upward to stand up, like taller and straighter. As for your anterior pelvic tilt or your butt sticking out, okay, well, it's impossible. Like if you stand, or even sit with your butt out, it's like impossible to flex your abs in that position, right? So we need to strengthen the abs to
Mhm.
then put your pelvis in a better spot. Now, with that, our spine does not need to be rock solid straight. We want a neutral spine, which is what we call it if you have neither. Of course, you want a neutral spine most of the time, right? When you're walking, standing up tall, all that kind of stuff. But what you don't want is you don't want an immobile spine, like doing cat cows, body rolls, like free moving spine mobility is so valuable and so not common. Like, who's just doing spine rolls? Like, is not common. But like, I remember when I injured my back, I was going snowboarding that weekend and I told my chiro and I was like, I'm nervous. Like, this doesn't seem smart. She's like, actually, that type of spine mobility, when you're like moving freely and not doing a strict like deadlift or a squat, is better for you. And it did not hurt. And I did feel better after I snowboarded. So that is one thing that is so easy to do. Like doing body rolls and cat cows every morning just makes it so that if you do want to strengthen those muscles, now your spine is going to respond. So yeah, I don't want you to think it has to be rock solid straight, but you can correct some of the things that are like really working against you, which is pretty much everyone who's had a baby. Does that help?
Yeah. Yeah, and that
Yeah.
snowboarding example is so good too because it made me think of just, oh my gosh, as we get older, you stop playing recreational soccer. Like you're a little bit more nervous to ski or snowboard. I mean, there's just like all
Yeah.
these things as you get older, or life gets crazy with kids, and you just don't do as much playtime stuff that moves your body
Yeah.
in that getting mobility in way. So it's like, okay, we need to replace it somehow. Like go play or
Yeah.
like do a few cat cows in the morning for 5 minutes. I mean, it's
Yeah.
amazing how small of time 5 minutes is, but just like you got to habit stack it in somehow.
Yes.
Like, however you
Yes.
do it, like
Yeah.
prioritize it and habit stack it in, and you can do it because 5 minutes will fly by. It's so easy, but oftentimes just never happens.
Totally. I talk so much about not sitting on the sidelines as a mom. That is like really important to me. And I think to my community, it seems to resonate. But like what happens as a mother, and I think in the past, especially like for our moms, and I do think that we are changing this narrative, and that's a really great thing. But I think it was common to just sit on the sidelines. Like, I can't jump rope. I'm going to pee myself if I run and play football with my son. And it's like dad who gets to do those things. And I just feel so strongly like I'm not going to miss out on the playing with my son. And I don't think any mom really wants to, like I think deep down that is something that's like not what they would want if they look back on it. And I think it's so hard because we think what our priorities are. But like to me, my driving force has always been my son. Like even when I was pregnant, I was like, okay, I'm gonna work out every day now because I'm taking care of him. Like like it starts now, right? And this is the same exact thing when I think like 5 minutes, like if it matters, you'll do it, like anything. If it's a priority, you'll do it. And that is how I really try to coach women on this. Like, if it's just about, hey, I want to stand straighter, I don't think that's powerful. I think what's powerful is I want to play with my son and I want to have memories with them that I will look back on. I don't want to think that I didn't or that I missed out. So I think the why is so important for creating those habits and like sticking to them.
Oh, I love that. And that
Yeah.
reminds me of just like spring break is next week. And it's
Yeah.
like my kids want me in the pool. And I for sure don't want to get my like nice hair all wet. But it's like
Cannonball.
F the hair. I'm getting in the pool. I am splashing. I am playing. I'm moving my body. I'm having the best time in the pool on
Yeah.
spring break with them. So it's
Yes.
just like, I love that why because you just forget. You're like, no, I'm
Mhm.
reading a book or I want to do this. And we're so tired and busy
Yeah.
that just laying and sitting for a hot second feels so good.
Yeah.
But
And it
it's
does.
so much better for life, for your kids, for your body, if you can play and move too.
It is. I mean, that's a different kind of energy, right? It's different type of endorphins that it gives you, and resting is good too. Balance is important, I think, more than anything. Like, I'm a Libra. It's all about balance. But yeah, I think, yeah, whenever I think about memories, I just think like, will I be able to like, I don't know. All the best ones are the ones when you think you didn't want to do it and then you did it. I think those are the ones
Yeah.
that stick the most. Like swimming in the pool with your kid, that one would probably stick. I always ask my son like what his like core memories are, and they always shock me. And they're usually like just small times. Like he always talks about a water gun fight me and my husband and him had in our backyard.
Oh,
And we were running and jumping, like, and I think about that a lot. And it kind of helps me like really put things in perspective. It doesn't always have to be like the most extravagant thing. I mean, sometimes it is, but I think that always like hits me.
yeah, I love it.
Yeah.
Well, I know we're coming up on time, but I'm also curious.
Yeah.
So, how old's your son? How far out from birth are you?
He's 5.
He's 5. Okay. So, what do
Yeah.
you do now to keep an awesome core? Sounds like continual breath work. Like, what are other kind of fitness and strength moves that you do on the daily?
Yeah. I mean, honestly, it doesn't look a ton different. Like I still include all the core moves that I think are way better than like a leg lift, if that makes sense. Like I could do leg lifts if I wanted to, but it's just like for me, doesn't feel like it's the most like bang for my buck anymore now that I know a little bit more. I really try to keep it functional and quick. Like I am a mom and I do have multiple businesses and I don't want to waste an hour working out. Even though I enjoy it, it still is like not what my plan is. So usually I'll start with some breathing and mobility. Then I'll make sure my workouts are hitting the core in different ways. Like I said, like an overhead reverse lunge is better than just like a lunge with your hands at your sides. So sort of just
Yeah.
thinking like bang for your buck in a movement, without being like crazy creative, right? Like keep the basics. And now like, what if I just put my hands over my head? Anytime, keeping it as simple as possible. Whatever your weight is stacked on top of is what's working. So if your hands go over your head, everything is working. Does that kind of make sense?
Yeah.
Yeah. So, like, that's how I like to think. And then usually I have like one compound movement in my workout. Sometimes I'll just do 2 to 4 exercises 4 times through. And then running is something that gives me a lot of like mental clarity. So I keep my runs like no longer than like anywhere between 2 and 4 miles is maximum. I've never been like a distance runner like I have, and it's not for me. But I keep them nice and short, and I think that's just like for me at this age when we become like over 30, running isn't going to give us the things it did when we were younger. But for me, it's a mental piece that is like really freeing for me. And it's also very quick. I can do that in 15 minutes and then I'm done. And I feel like I'm done for the day. I don't feel like I did less or anything like that. Um, so yeah, I keep it simple. I move probably 4 to 6 days a week. Usually I'll take like a day off and it's usually a busy weekday. Weekends, always try to work out with my son. I think the more we do it with our kids, the better. He thinks work is working out, for the record. That's like what he thinks. He's like, Mommy's going to work. And I'll be like doing kettlebells in the backyard. And I'm like, he's really going to be confused when he gets older. um, but yeah, so I always try to include him. We try to include him as much as we can, and it gets easier. It gets better. The more they are exposed to it, the less they are annoyed by it, if that makes sense. Like, then they want to be a part of it, and that becomes really rewarding. So, yeah, now it's just that I like nutrition. I don't think hard about it. I eat things I want to eat, but I don't overeat. I think that's like the biggest piece of it. I think I spent so much time, like I said, kind of pre-pregnancy in this world of like needing a flat stomach and all of that. And like, I don't know. I think that I'm just so happy where I'm at. I think I'm proud of what my body has done. And I think every mother should be proud of what their body has done, especially if you're doing the work, you know? Like, I'm not saying you shouldn't be proud if you're not doing the work. I just think like in the back of your head, if you're like, I'm working out, I'm showing up, I'm happy with what I'm doing, then what more can we want, you know? Like, I think that that's perfect and that's exactly what it should be. And there might be another time and place in our life when we do have 2 hours to work out and maybe when we're 50 we get six packs, but like, you know, that's not where my life is right now. And so I think there's a lot of like, if you can take that high cortisol stress that doesn't need to be there out of your life, your body will actually respond like so much better. If that
Yeah.
makes sense.
I think that's the struggle with the external validation piece too, because everyone, kind of like you were saying, like in me in my 20s too, you get caught up in how you look and how the external validation is,
Hmm.
do people see you as a hard worker and like having a hard work ethic. In reality, like you can't see your core, but that's, those type of things matter. Like
Hmm.
inside your mental health, all the things that you can't see are key pieces that matter. And so
Hmm.
it's how do we have that internal knowing of having strong core, having a strong mental game, focused
Yeah.
on what's valuable in life. Like all of those things need to be front and center and knowing how proud we are of our bodies, of making it through this crazy thing called birth and raising
Yeah.
kids. Like
Yeah.
all those pieces are so important, but still we're like, "Oh, my body's destroyed from the outside. Like everything's
Yeah.
hell in a handbasket." So, it's like that mental reframe is huge.
It is. It's hard. It really is. And I think like what I can always tell women, like especially the ones I work with in person, and they're saying, you know, I want this, I want that. I kind of like the things you were just saying, and I'm in my head or out loud to them, I'm saying, where is the time for the things that you want? You know, like the time isn't there. That's okay. Like you being these kids' moms, like when I'm thinking of a specific client who has 3 young kids, and one is like 6 months old and she's really hung up about her body not changing, and I'm like, "1, you're showing up here 2 days a week. It might not be the speed that you want it to be, but this is what you have to give, and that is perfect." Like, I think we over assume, like, I think we think we can do so much as a mom, and we can, but at the same time, there is always gonna be a limit, and there has to be things that you look at and you're like, "I am glad I'm giving my time to my kids instead of to my more time to my body." Like, I am giving time to my body, and I am slowly working towards it. I'm not doing nothing, but, like, where I'm at is where I'm, like, happy because I think, like, expectations are the hardest thing, right? You think you just go to the gym 2 times a week and then you're gonna change, and I think that is not always true. And I think if you think that, now you're disappointed. So I really
Yeah.
try to give women like realistic expectations of like, you might not get exactly where you want to be right now if you don't have 5 days a week to work out for 20 minutes or 30 minutes each. If you have 2 days a week, that is still good. And you are still doing enough because right now you don't have a nanny and you have your son and your daughter and your other one's not sleeping. Like there's times when it'll come back around, and I think seasons are just such a really, like, useful way to look at it as, like, this is a season. But, yeah, I think, like, stepping back and taking that bird's eye view and also realizing like I am doing everything that I can, I think can be helpful. And then I think there is going to be a time when you do have more time and now you can do more, like
Yeah.
if your kid is sleeping through the night, like you probably can wake up and work out in the morning. It's not about being soft forever, but I think having a softness to motherhood and to yourself when the time is right is important. And then I think being realistic and being like, well, I've been sleeping 8 hours a night for the last 2 months. I could probably wake up and work out in the morning. Do you know what I mean? Like, I think there's the right balance.
Yeah. And I wish I would have known that or been at least flexible and creative thinking around it from the get-go too, because for me specifically, I'm thinking I was like, workouts have to be 45 minutes. They have to really hit home to do it. So I was very much like, let's schedule that in. Like, let's do it
Mhm.
3 to 4 times a week from the beginning. When really thinking back on it, it's like, no, I could be lying on the ground playing with my toddler and doing something for 5 minutes that could really benefit me once a week. Or like your kettlebell
Totally.
example of being in the backyard. Like if you
Yes.
had a kettlebell, 15 minutes, and then your kids go where you go and they're
Yeah.
outside playing while you do a kettlebell workout, like doing that once a day or, for
Yeah.
5 days a week is amazing. You don't need to
Eh,
do an hour for every single day or just one walk a day. Whatever that small amount is
yeah.
that works for you, it can integrate with being with your family. You don't have to
Yeah.
carve out an hour every day to disappear for a workout.
100%. Yeah. I think it just comes down to like keeping your mind really open and being like okay with flexing and like seeing things in different ways and just like realizing that we have to grow and shift and move with this whole life of ours as women. Like we don't stay stagnant. Women don't stay stagnant. They don't stay the same. They change. And I think that like evolving with yourself is like the best way. And I think the most healthy mindset I see women have is when they're like open to evolving and changing things because that's how life goes.
Yes,
Yeah.
so good. Well, is there anything else that we didn't cover in terms of tips that you think are super critical? I'm like, have so many good
Mhm.
takeaways, like keep my back
Good.
flat.
Yep.
And I'm going to check my posture after this. Is there anything else that we didn't cover that you'd want to throw out there?
No, I think we covered a lot, honestly. I think it's good. And then some of the stuff is so tough to teach on here. So I would definitely say, like, stay patient and, like, you know, visit my Instagram. I post a ton of free things. And I think, like, find support, like, from a coach that you trust because I think um, it, I don't have an accounting degree. I don't do my accounting. So if you don't have a personal training degree and a pre and postnatal degree, I don't think anyone expects you to know what to do. So I think like let yourself off the hook. And I think it's certainly the best time to pay for a program to have someone walk you through it because it's tough. It's confusing. So stay patient.
Love it. Well, Erica, thank you so much for joining us.
Yes. Thank you for having me, Erin. This was so much fun.
And then if people do want to learn more, where can they visit you?
Yes. So at Erica Wald _ on Instagram. That's the best place to do it. EricaWald.com has a lot about my programs. I offer a free week always if you just want to give it a shot. And if you're in Denver, I own Commit Fitness Studio. So absolutely come check it out. You can mention this podcast and I'll give you a free class.
Awesome. Well, thank you again.
Yes. Thank you. Bye, Erin.
Thanks for listening to another episode of Find Your Fuel. If you enjoyed the show and want to support us, please leave a comment or review. And before we go, I have to give you the obligatory medical and legal disclaimer. This podcast is for informational and educational purposes only. The advice and recommendations we discuss are not intended as medical advice and do not replace the treatment or care of a physician or any other primary healthcare provider. Using the information shared today does not create a doctor-patient relationship, and it should not be used to diagnose or treat any health problem. Always consult with a qualified healthcare professional before making changes to your diet, exercise routine, or medications. The use of any information provided is solely at your own risk. So in a nutshell, let's be smart and remember these stories and conversations are for educational purposes only to help other women find the fuel to live their best lives. We'll see you in the next episode.